today. But the next thing we want to do is to hear from our priority groups and what they've been up to, what their plans are, where we're headed. You've already heard from Dr. Baskin, and our focus has been around our health equity. So that priority group is not going to present right now. But the other priority groups are going to present, and we're also going to hear from the Walker County Health Action Partnership, who are absolutely partnered with us and hear what they've got going on as well. So first up is the Optimizing Healthcare Access. And here to present on that group's work is our very own Dr. Mark Wilson. Welcome, Mark.
Thank you. Before we start, I just need to clear one thing up. I have my reputation to be concerned about. These glasses are not, these are progressive lens. So I'm not like those other people. The reason I have these is my wife came to a couple of my speeches when I first became health officer and told me that when I do this, I look really silly. So she talked me into it. Okay, down to business. So yeah, we have the Optimizing Healthcare group, and here's our goal: optimize healthcare access, availability, and utilization. That word optimize is really important. This isn't about just more health care, because of those of you that know about public health realize that we have a lot of health care, right? We just have a maldistribution of health care, and we have overutilization of certain types of health care, and our health care costs are ridiculously high. So we want to make sure that it's appropriate, the right setting, and that the people who aren't getting it get it. We organized pretty recently, we had our first meeting in November, I believe. And these are some of our partners, a very robust group. I'm not going to read through all of these, but significant is that we do have major hospital systems at the table, and that's very important to making this happen, as well as some outpatient providers, insurance companies, and also some nonprofits that can help promote healthcare utilization in an appropriate way. So everything, all of our priority groups are challenged to come up with metrics, things that we can actually measure to know whether we're having an impact or not. And as Drew mentioned earlier, a lot of what we're trying to focus on is some of the county health rankings the Robert Wood Johnson Foundation puts out, or other data that we have readily available already, so we don't have to spend a lot of time and effort and expense getting data. Try to use what's there. So some of the things that we're looking at trying to impact are the percentage of the population without health insurance, still a big issue in Alabama. Cancer screening rates for adults, and number of preventable hospital stays. We actually have measures of this for the Medicare population, and this is something that hospitals have a huge stake in because this affects their bottom line and how they're paid. And then one thing we're going to try to do, we don't have readily available data on this, but we're going to try to see if we can get it, is some type of measure of avoidable emergency room visits. Because hospital stays is sort of a relatively small number, but emergency room visits is a really big deal. And a lot of people obviously are using the emergency room that could be better served somewhere else. So we've chosen three major areas to focus on. One is policy, and one is primary and preventive care, capacity and coordination. The other is identifying the data that we need to determine hot spots in the county and also to measure improvement. So a little more on those. What we did is we very quickly broke down into some working groups to focus on each of these. So two policies. Well, first of all, we're adopting the CDC's policy process tool, a very robust tool that we're going to be using, and the Health Action Partnership in general is going to be adopting this tool to help guide our policy work. And some potential policies that we're looking at bringing forward to the leadership team of the Health Action Partnership for some type of adoption and perhaps advocacy. One is closing the coverage gap. You know, people under 100% of poverty level in Alabama do not have the ability to get health care coverage under the Affordable Care Act because Alabama has not expanded Medicaid. So that's one. And the other is called All Payers Claim Database. Something I'd like you all to be familiar with. We're hoping that maybe something can happen in this legislative session. This is where we can get data from third-party payers like insurance companies at the zip code or census tract level. Things like how many people have diabetes, how many people have emphysema, etc. We currently do not have that data at the zip code level or anything below the county level. So that makes it really hard for us to move the needle in those areas because we just don't have the data. And a lot of states do have that capability, and we'd like to have that in Alabama. And there may be others, but some of those will probably be farther off in the future. The second is identifying data to determine hotspots. We've decided very early on that as a group we couldn't really impact measurable things for the whole county at once. It's just too much. So we've decided very early we would have a zip code focus where we would focus on one or maybe two zip codes where we would all work together collaboratively to really impact some of these numbers, some of those measures at that zip code level. We want to focus on things that have a high volume, high impact. You know, it may be things like blood pressure. If you can control blood pressure, you can prevent a lot of strokes, heart failure, kidney disease, etc. Or diabetes is another great example. And then focusing on high-cost preventable hospitalizations and emergency room visits. And then using the above data to try to get people channeled into primary care utilization that's appropriate, the appropriate setting to get care as opposed to an emergency room or getting, hopefully preventing hospitalizations, and also where people can get some of these prevention activities such as mammograms, pap smears, colorectal screening. So we're currently working on getting that data so that we can choose a zip code or maybe a couple of zip codes that have a lot of health disparities, a lot of need, where there's a big room for improvement. And the third area we're looking at is increasing primary and preventive care capacity and coordination. So some of the ideas that we're working on, one is to develop a nurse practitioner residency program, or maybe more than one program. We have a shortage of primary care providers for the low-income population or certain areas of the county. When we look at the number of physicians who are technically counted as primary care physicians on the county health rankings, we're actually very high, like 97th percentile or something. But the problem is they're not really doing the primary care in the underserved areas. There might be an internist who's a subspecialist in rheumatology somewhere, and not really what we're trying to focus on. It's also a challenge attracting primary care physicians to our county. Everybody's competing for primary care physicians because there's a shortage nationwide and it's going to get worse. So nurse practitioners, I think, are a big part of the answers, perhaps physician assistants as well. And we want to provide a training opportunity for them. When they come out of training, they can hone their skills more in a setting that's public health / indigent care, high need areas, and hopefully win them over as part of the team for some of our institutions that do health care, like the health department or Cooper Green or some of the FQHCs, and also hopefully just have them stay in our county and become passionate providers for underserved populations and committed providers. We're going to explore the community health worker model to try to connect people in neighborhoods, people from neighborhoods, connect people from in those neighborhoods to screening services, to appropriate health care. Once we identify the zip code or zip codes, we will begin partnering with community organizations in those zip codes, as well as larger nonprofits like Cancer Society, American Heart Association, et cetera, that can bring some of those resources to bear in that focused manner. And so these are things that we can also use to channel people into primary care. The nurse practitioner residency program could not only be a pipeline for workforce for our future, but as they're training, they could be an access point for people to get connected to primary care and preventive services that had not been connected. So again, just to review the measures of success that we are looking at, we hope to decrease the uninsured rate. That would be mostly through policy change to close the coverage gap, decrease preventable hospital stays, decrease avoidable emergency room visits, and increase cancer screening rates, for which we already have good data available. Next steps, again, we're very early in this process. All of this is conceptual at this point, but we have great partners at the table who are very engaged. Further develop our healthcare policy advocacy options using that CDC tool. Establish our prevention quality measures in more detail, and come up with an ask for the participating health systems to say, would you be willing to help provide some of this data on your emergency room visits, on your leading diagnoses, and pool that data for this target zip code and let us use that. And at the same time, as a healthcare system, you stand to benefit. There's a win-win here, right? The hospitals get decreased unnecessary and uninsured utilization. They win and the community wins. Use the nurse practitioner residency program accreditation standards that were just released in December as to help us outline a program. We are hoping to try to get a small pilot program started this coming academic year. And then we will be pulling together a community health worker presentation from a local nonprofit that does this work. And we are hoping to be able to invite any of the other priority groups to that presentation, because I think some of the rest of you would have an interest in that concept as well. So that's it for us. Thank you very much. Gus Hurd Hughes, Community Foundation.
Thank you. Good afternoon. I am Gus Hurd Hughes with the Community Foundation of Greater Birmingham. Back in the fall, we committed to serve as the backbone organization for the Improving Mental Health Priority Group. So we are also working with a great group of organizations that are around the table. And a lot of our planning was concentrated in the fall, and now we're in 2016 launched on some initial plans. So I'll talk about that. So our goal is to increase the availability of and access to mental health services for children and adults in Jefferson County. And that comes right out of the community health assessment that the Jefferson County Department of Health conducted in 2014. One of the key goals under the mental health priority. As I said, we also have a list of great organizational partners, and this is not everyone by any means. But this is just some of the partners we have around the table. And you can see we also have a good mix of service organizations, hospitals, public agencies, funders, etc. So what are we measuring? Again, we're looking at the data that we have available at the county level. So that includes 4 mental health days per month. The BRFIS survey that's conducted all across the U.S. That's one of the questions that are asked. At a local level, JCDH is tracking the suicide rate. And then the mental health provider to population ratio. So we're tracking all of these. you'll see in a minute, I think where we're going programmatically, or in terms of a project, is a little more narrowly focused than that. So we're leaving the door open to have some additional metrics that we look at as our project develops. So when we started planning in the fall, we talked a lot about what are some principles of planning that will help guide and focus us. We talked about several, but I wanted to highlight one, which is building on strengths to meet mental health needs. So we know there are a lot of needs. We know there are a lot of challenges. We know, the system is changing quite a bit. The funding structures are changing, and it's easy to get discouraged. But we think there are also some great opportunities and strengths to build on. So with that framework, we really looked at a few different possible directions, but we decided to focus on children's mental health services. We know from schools and service providers that there are significant needs in terms of children's mental health. There are great programs out there, but there are some real gaps. And we, for example, to take it to a kind of a neighborhood level, the Woodlawn Foundation surveyed the schools they work with in the Woodlawn Innovation Network, surveyed parents, students, teachers, administrators, and mental health related needs really rose to the top in terms of community programs and community programs that were needed within those schools. And we've heard school systems across our footprint say the same thing, including throughout Jefferson County. In terms of a strength, Alabama, as you all know, provides broad coverage for children, insurance coverage, between Medicaid and the state CHIP program, All Kids. It's one of some of the most comprehensive coverage in the country. Adults, there are more gaps, as Dr. Wilson alluded to. There's pretty good coverage for children, so how can we leverage that strength to do more to fill those gaps? So the first thing we realized, so we got together around the table and everyone said, yes, this is something we really need to work on. We had providers that were already using Medicaid and/or All Kids. We had providers that would like to, but were somewhat daunted by the hurdles. So we said, we need to learn more about this. We need to learn what the real opportunities and barriers are. So we're in that learning phase now. We're bringing in a series of speakers every month to help us sort of understand that system. One caveat is that system, as always, but particularly now, is changing. Medicaid is moving to a managed care model with the regional care organizations. Mental health parity with the Affordable Care Act and some earlier legislation is creating new opportunities. In many ways, there's a lot in flux, but I think there are some opportunities built in there as well. So we're trying to learn as things are changing, but that's sort of always what you have to do. And then based on what we learn, we're going to explore a specific project to expand children's mental health services in the county. So the progress that we've made so far, we've had speakers in our January meeting. The leaders of Gateway and Oasis came and spoke to us about their experience billing Medicaid and All Kids. In February, we'll have Dr. Richard Craig with JBS Mental Health Authority, the mental health authority for our region that coordinates mental health services. And March through May, we'll have speakers from the school systems, very important, from the Department of Mental Health, Alabama Medicaid Office, All Kids, and possibly some others. And roughly around the summer, and after the legislative session, by the way, so we'll hopefully by then have more of an idea of what's happening with Medicaid funding in the RCOs. We'll review findings and plan a project to expand the services. Now, I know that sounds rather vague, but I do think there are some parallel projects that already are providing some momentum and that we can potentially align with. A couple of those that I'll highlight. The Community Foundation we have committed some resources to support planning around a school-based health model that integrates primary care and mental health. It's been done all around the country. There's nearly 2,000 school-based health centers. It's being done in other parts of Alabama, including Gadsden nearby. So it's something we want to explore here, and it's a way to make mental and physical health services more available to students where they are, which is in school. And the outcomes, the research shows there are good health outcomes and other outcomes related to that. So we are planning, the Community Foundation is also planning a request for proposals in the fall related to mental health, and this process will certainly inform what that looks like. Bold Goals is looking at the connection between mental health and education and leveraging their relationships within the education community. Gateway, as an example, is piloting some mental health counseling in the Alabaster school system and in 2 of the Woodlawn schools. And there are a lot of other great organizations doing good work, Eastside Mental Health and Oasis and many others. So there's a lot there already that's percolating in this field, and I think once we get a better handle on all the ins and outs of Medicaid and all kids, we can really look at how do we leverage that. So that's it for mental health. I will now pass the mic to Ryan Parker to talk about built environment, transportation, and safety.
Thanks, Gus. So about halfway through Siobhan's presentation, I said, I'm going to have to follow this at some point. So thanks to Gus and Dr. Wilson for just having that in there to bring the expectations back down to a level that I'm more comfortable with. So the Built Environment, Transportation, and Safety, this is a group that the United Way is the backbone support for. And when we say built environment, the term is thrown around a lot. That's essentially just things that are man-made. So the building that we're in now, the roads that we use to get here, the place that we go home to, the schools that our kids go to, the places that we shop, this is the built environment. This is what we interact with on a daily basis. Transportation is how we get from point A to point B. So the United Way obviously hears from our partner organizations that are serving clients that have transportation needs. So it's something that's very real to us, something that we saw as an area that we needed to support. Safety deals with broad kind of public safety as well as injury prevention. So that's the 3 components of the group, all really big things. So we're trying to tackle them as best we can. So the goal of the group includes the availability and access to places to be physically active. So parks, sidewalks, trails, things like that, as well as the creation and sustainability of a reliable transportation system and safety of the physical environment. Again, some partners that have been involved in this work so far, I won't read them, but a nice mixture from city governments to nonprofits that are working in all of the built environment, transportation, and safety areas. So what are we measuring? So we're looking at the percentage of adults reporting no leisure physical activity time. And this gets to the way that we design our communities, how accessible are things for people to be physically active. We look at the locations of places where they can do that. So how close is a park? How close is a sidewalk? Do they have sidewalks going by their home or connecting them to their school? These are the things that we're looking at to try to improve, to just enable people to be able to live a healthy life where they are. So action planning. We, in initial meetings, had some ideas about what do we tackle, what's a project that we can look at. And something that's been discussed in the past is beginning to prioritize projects that receive federal funding that are sidewalk, trail, and bicycle projects. Lots of cities have those projects, and a lot of them are not progressing just because there isn't some sort of prioritization list. So we said, what if we created a prioritization list? And for a variety of reasons, it didn't really come to fruition, but we did work with the city. They said, we're developing a prioritization framework, the city of Birmingham. We're developing a prioritization framework for some of our infrastructure projects. So they're talking about street repaving and sidewalk construction and home demolition. Things that fit nicely with this group, and they said we're looking at developing something like that. We're looking at the immediate safety needs of a house that might be about to fall in, or the potential revitalization of an area that might be kind of on the verge of it. They were looking at how it aligns with their comprehensive plan and subsequent framework plans they're developing. How does it align with transit routes? So there are all these things that they were kind of putting into place, and they said, you know, we'd love to include health in that conversation. So we were able to kind of tap into that process, and I'll talk a little bit about that in a second, developing a health equity index. We said we don't want to take one specific health factor and say that that encompasses health of a community, because it doesn't. So we worked with the Advancing Health Equity Group to begin to connect to these groups, which is what we're talking about today, to look at things like infant mortality rate, life expectancy, poverty rate, which is so correlated to health. And said, what if we took those three things and the data was already there from the Place Matters report, which Dr. Baskin talked about earlier, and what if we consolidated it and put it into a list of, by census tract, essentially from the healthiest census tract in the county to the least healthiest, and allowed the city to use that when they're making decisions about if a specific project is within a census tract that is viewed as the most unhealthy in the area, let's prioritize that. So we developed a initial phase of that, and we're continuing to do that. I know this is tough to read, but this is an idea of what the city is developing. So you see a specific project that might be a street repaving project, or it might be a home that's on the demolition list, and they're looking at different categories that they are essentially grading and then adding it up at the end and saying the highest score gets priority. So this will just have a column essentially for health, which is something that didn't exist before, and something that we're really excited about, that we're able to consider health as they're making these decisions. Again, it's tough to read, I know, but this is all the streets in the city of Birmingham, and I'm sure if I put a map up of all the homes that are on the demolition list, it would be equally as overwhelming. So you see just how big these decisions can be, and just to be able to weave health into that conversation is something we're really excited about, to be able to transform communities in the built environment in our area. So our action steps are to continue to work with the city of Birmingham to ensure that health is taken into consideration for planning decisions. It's obviously, we have this health equity index that's beginning to be created. We want to make sure that that's implemented and put into place so the decisions do include health. Similar to other groups as well, include speakers. We recognize that when we're dealing with the built environment, which is a lot of different things, we're dealing with transportation, we're dealing with safety, there are lots of things that we don't know, and there are more people that we need to bring to the table and learn from to figure out where can we support them in their efforts. So we're going to be hosting speakers as well around topics such as transit and bus rapid transit and things like that, to figure out what's happening and how can we support that. And then last is just continue to develop that health equity index. We've created specific for the city of Birmingham and a project that they're working on. This is something that's county-wide, and we think that there could be a lot of different areas that we could use this for other priority groups, for other organizations that just are interested in focusing resources in areas of need. We really see a health equity index as being an avenue to do that. So that's what we're working on now, just trying to create communities where people are able to live a healthy life. So with that, I'll hand it over to Terry from the YMCA.
Good afternoon. Good afternoon. Good afternoon. I'm glad Ryan said, who comes after? See, normally they have a headliner, and then they have the people before the headliner. They brought the headliner first. But I would dare to say that each of these priority groups are headliners. And it does my heart good as I sit and listen in preparation to speak, knowing that we're all working towards some common goals, and we're using some of the same data, and we're all speaking some of the same language. That didn't happen 10 years ago, ladies and gentlemen. I've worked for the Y for 24 years, and I am living proof. These conversations here did not happen 10 years ago. And so I am proud to say I'm the next headliner. So here I am, and I am here to talk about promoting healthy lifestyles. And this particular group, the two backbone organizations are the Alabama Department of Public Health. You've met Dr. Wilson this morning, and the YMCA of Greater Birmingham, our president and CEO, Stan Law. I am not Stan Law. I'm Terry Harville. But my presence is not an indicator of his lack of support. He's actually out of town, and we could not figure out how to clone him in time. So you get me today. However, my job is to do this work back at home. So he does a lot of the speaking, and I do a lot of the doing what he says to do. The goal of this particular work group is simply to promote physical well-being through healthy lifestyles. How are they going to do this? Well, I didn't do that right. Or is it? That wasn't in my notes. So, here are the partners. See how we're working? Here are the partners. The partners that are working on this particular segment are listed right here, ladies and gentlemen. That means that there are a lot of folks who are inputting into this work, and we thank every partner that is represented here and the ones who are not present. What are we going to measure? As several of the headliners before me stated, there are a lot of things that we could measure, but we've got to bring the work down so we can actually do some things to measure appropriately. So they chose 3 areas. The first is percentage of adults who are current smokers. The second, the percentage of adults reporting no leisure physical activity time. That's 0, zip, none at all. Not even walking from the car to work. None at all. Index of factors that contribute to a healthy food environment. So those are their three things we're going to measure. Now, how are we going to get this done? So the physical activity work, one of the things that we want to do is to overlay health equity index data with current park assessment data for the city of Birmingham to identify priority areas. Sounds real good. What does that mean? Where are the places where people can go with those good parks like Railroad Park? Versus, how does that compare to where people need to go to exercise, but they don't have that wonderful option? Second thing is coordinate efforts with the National Let's Move Outside initiative, REACH initiative, exercise prescriptions, etc. What does that mean? So I am proud to announce that there's a new initiative that just came our way here in Birmingham that involves our First Lady, Michelle Obama. Some of you may know her. The Department of Interior and the YMCA of the USA. So there's more to come on that, but I can give you a little secret, a little hint, a little bit out of the bag since you're here today. That initiative deals with how do we use public land, like parks and other public lands, to promote healthy activity and service on that land with children and families. Oh, more to come. I got you right here, more to come. With our REACH grant, we have already extended some of the work that we have done by promoting exercise classes throughout the community in certain zip codes where people can come. So in the past, folks have said, well, I wish I could go here, wish I could go there. I can't afford. Well, it's free. You can afford free. So getting back to those choices, we're making things accessible. Through our CATCH and HEPA initiatives, we're promoting physical activity and healthy nutrition no matter where you live and work. With the exercise prescriptions, the health department is taking the lead on that one. What else are we doing? Focusing efforts on pilot project areas for park enhancements and community engagement. Also supporting community-based efforts to address barriers to outdoor recreation. What does that mean? Every park is not every park. A park is only viable if I feel safe to go. So the question you have to ask yourself is, would I let my mother go walk there at 5 o'clock? Would I myself go and walk there? So we can build walking trails, but they're no good if people don't feel safe to walk on them. So how do we make people feel safe to walk in these environments that we're identifying? And how do we bring groups of people? It's always better to walk with a friend. You have so much to talk about and share. It's always a better atmosphere where we can get people to meet each other. And so the physical activity part is one thing, but there's also a socialization piece when people are getting healthy. So if you believe that, just say amen. Amen. There you go. See, that's who you were this morning. I need that one right there. So our nutrition work also speaks to supporting high-quality summer meal service expansion in coordination with the Alabama State Department of Education and the End Child Hunger in Alabama Task Force. We're going to expand our vending initiative using the Alabama Department of Health Good Choice program. So some of you remember the last time I came before you, talked about when we were getting this started. So I'm happy to report in 2015, we met our goal at the YMCA of making sure that all of our items in our vending met at least 50% of those good choice standards. You say 50%, that's not good. So those of you who weren't at the first one, we had to report that at that time, some were meeting 0%. So we had to go from 0 to 50. And so our goal for this year is to get to 70%. and 2017, 90%. Now, we're going to expand our healthy eating and physical activity standards via the CATCH curriculum to impact more children. Well, what is there? Are you catching a ball? Are you catching people? What are you catching? You're catching good health for kids. CATCH stands for Coordinated Approach to Child Health. And that's an evidence-based curriculum that we at the YMCA have been doing. But last year we were able, through the REACH grant, to actually train and equip the YWCA as well as the Boys and Girls Club, and most recently to expand that to 8 sites in Birmingham City schools, where we are now inside of the schools doing after-school care. That's expansion. That's how we bring the work to the people. We're also promoting our Food and Fun curriculum, which brings fresh fruit, healthy vegetables, not only to the children, but to their parents. Somebody said it earlier. It doesn't help to have fresh fruits and vegetables that people don't know how to eat properly, don't know how to cook, or you look at it and you say, I see that in the store, or that's not in my store. Where do I get that? And then, is it really edible? So you really mean that grape isn't just a flavor? It really is a fruit? That's what we mean. And there are really children in this community who have said that. Because for a lot of children, grape is a flavor of Kool-Aid. That's what that is. Yes. So, this is how we do that. It's not just a soda. It's an actual fruit that you eat, ladies and gentlemen, if you can afford it. The health department has done an outstanding job with tobacco work. They're going to assist in the education and cessation efforts in all housing and urban development, multi-unit housing, and they're going to continue their work on comprehensive smoke-free ordinances in local municipalities. We didn't know what that was 10 years ago. I went on vacation, and I said, thank God for smoke-free Jefferson County. I went to a restaurant, and within 5 minutes, we had to leave. I'm not used to going into smoke-filled atmospheres anymore. Give yourselves a hand for that. That's the policy work that makes a difference. We can say it all day, but until you go into restaurant after restaurant after restaurant, and this is the non-smoking section, and right next to it is the smoking section, you can appreciate this work a whole lot more. And sometimes we just take that for granted, but this is real work making real impact. So, what are the next action steps? We're going to continue to advocate for the prioritization of improvements as an intervention to promote outdoor physical activity and continue coordination between physical activity work and nutrition education and support for children and families. Because like the doctor said, you can't have the product without the education. They go hand in hand. So simply put, this particular group has definitely said that they are committed to coordinating efforts of community partners versus working in silos. It all goes together. And they, at this point, have a desire and a commitment to meet once a month. Thank you so much.
Thank you, Terry. Terry mentioned that she was a headliner. So, since this is the bottom of the agenda, the only way that I can look at this is that I'm not a headliner, I'm the cool down. This is your cool down for the afternoon. This morning, Drew opened up the very first thing talking about the fact that his footprint, the United Way's footprint, serves the healthiest county in the state of Alabama and the least healthy. So we couldn't get anybody from the healthy county. I'm here from the least healthy, the 67th county. And I say that with just a little bit of chagrin. I'm kind of mad. Siobhan came in here and did such a great job. She made me mad. She made me happy. But she didn't, she took on some subjects, but she didn't take on the most sensitive subject in the state of Alabama. She did not say anything about Auburn, Alabama. I thought she had more guts than that. But before I start, over in the corner, I have a young lady that I would like to call attention to. We do have a Health Action Partnership, but we've got someone that wakes up every day worrying about it, worries every day about how to feed it and care for it. So I'm going to make her turn her favorite color. Elise Peters, would you please raise your hand, stand up? As somebody that did not come from the Crimson Nation, and I read her emails, and every one of them closes with "Roll Tide and Radiate Love." It just takes a little bit to choke it down. We've got bold goals. I really am going to get to something of importance here in a minute, but I only had 3 minutes of good stuff, so I had to fill the bold goals health. I want to, I don't know whether we should call it bold goals health in Walker County, or if we should call it something like overly ambitious goals. Or maybe we should lowball it and call it sort of kind of bold goals. Because we've got so far to go. So far to go. Terry ended up talking about smoking cessation. I think I want to come up with another word for it. Who's flipping the slides here? Shit, am I supposed to do that? We're not going anywhere in a hurry, are we? We have been working kind of just across the board with everything, trying to do something, trying to move the needle. I need a better phrase than that. I don't like that one anymore. But always trying to push, and we weren't getting there. So thank you, Katie Peters. Thank you, Elise Peters. Thank you to our partners. They said, whoa, wait a minute. Let's just back up a second. When I think about Jefferson County, I think about a couple of things. And one of them, when I compare it to my home county of Walker, is you got 660,000 people. Imagine you got 10 of those people in the room. You take 9 of them and you send them to the parking deck. You got 1 left. We've got 66,000 people in the whole county. And somehow we've got to have the same degree of excitement and that same investment that you guys are able to do. You've got a bigger pool to work with, and we're a little bit jealous of that. But they said, stop, look at what you do have. And this is a fact that just blew me away when we first looked into it. But Walker County has 260 churches. 260. I mean, that's like, a church for every 10 people or something. I didn't do that. But, okay, there's a delivery mechanism that we're not touching. And then we really have 3 school systems. Excuse me, 1 city system, 1 public county system, and then we have a private school in Summiton. And I don't mean to marginalize them, but I'm just going to, when I talk about schools, I'm talking about the city and the county system. So we said, that's it. We're going to work with those 2 things. They are the common thread in Southern Alabama life and Walker County life. It's the educational system and the sports system and your church system. So we're going to try to work with them. We've got some really good people to work with in the school system. They've got aggressive grant writers in the county system. They've got 21st century grants that are in every school. The problem is they've got excellent physical education equipment in those schools for the faculty, student, staff, but some of them can't use it because it's still boxed up because they don't have a place to use it. So we've got to figure out how to make those things happen. We're working with, I've got my little table over here at the University of Alabama, some of my new friends. Some of my old friends aren't there from the Capstone College of Nursing and the School of Social Work and the School of Education. But Dr. Deborah Wisnan is helping us find 5 churches, and those 5 churches are going to be the seed. Mustard seed, kudzu seed, whatever you want to think of it. But they're going to be the seed. And you have people in the churches, just think when you come on Wednesday night, when you come on Sunday morning, when you come on Sunday afternoon, or in some churches if you just kind of stay there all day. You've got people in there that will be your accountability buddies. They may not be a health professional, but they can put a blood pressure cuff on and read a digital readout. And they can look at things like your blood sugar. And if you don't have the copay or you're not taking your medicines, they're going to want to know why. And you've got somebody that you really got to be accountable to because you already know that. So it's going to be hard to say no. I am real tickled. I don't see Christy Swade in the audience, but I am pleased to say we may be last in some categories, but we are the first county that has every school participating in the HEAL program, Healthy Eating Activities. Quite honestly, I got to give the credit to that to Christy Swade and to the Superintendent of Education for the county school system because he saw what was going on in the city system and he got a little bit jealous. And I'm all about jealousy. That's fine if that's what's going to motivate. I say that kind of unkindly. Dr. Atkins is a great guy. He does things for the right reasons, but he saw it was working. So he went out and got the resources to put it in every school, and for that I'm grateful. When I look at those same schools as a delivery mechanism, I think untapped resources. We've got family and consumer sciences right there with the health occupational safety folks, right there with the agribusiness instructors. And we've got them, they're in the communities where we have these food deserts, where we don't have produce. And most of these schools, they have a campus where you've got the elementary with the middle with the high. The elementary kids can be walking over to the greenhouse. So that's what we're trying to do. We got a $50,000 grant. Oh, I'm not used to this. Somebody's clicking my, okay, there's another slide. When Elise put this slide together, the first thing I looked at, I saw the kids are playing disc golf. We do have 2 PDGA Frisbee disc golf courses in Walker County, if you like something like that. But those are examples of some of the inside and outside physical equipment, physical activity equipment that we put in the Head Start program. And I'm thrilled that we are second only in your footprint, Drew, in the number of schools that have Head Start. We got a grant from the Appalachian Regional Commission for that, and for that we're really grateful. We also, the greenhouse, that is at the Center for Technology. All of our high schools feed into that school. So if somebody wants to really learn, you know, some of the other trades, great, but if they're really interested in plants, horticulture, landscape design, architecture, we can send them back out in the community and help us with those small farm markets. Click. One more time and I'll be good at this. We're working on, with the Regional Planning Commission of Greater Birmingham, an open space inventory. I think the first thing that's listed up there is the recreational amenities of Walker County Lake. Most of the people in my community don't know that they've got a 420-acre public piece of property out there with 163 acres of water. There are 22 state lakes. This is the second largest one. And most people drive past it, walk past it, go past it, don't know that it's theirs, that it belongs to them and they should be using it and they can use it. So thank you, Chris Nani, the Community Foundation of Greater Birmingham. Gus Hurt Hughes is somewhere in the room. Thanks to them, we were able to engage a landscape architect and about 20 members of the community. They spent about 100 hours of their time going through this thought process and came up with a master plan that's on foam core outside. It's not incorporated into this, but it's one of those things that we're trying to do to get people to understand. Terry was talking about it. You know, it's kind of funny. If you have a sidewalk, they just think it's a sidewalk. You call it a trail, and all of a sudden, hey, you have a trail. You had it yesterday, but you just have to point it out to them. I'm going to miss a whole bunch of stuff in here because I'm supposed to go really quickly. We started a thing that we copied. We've got a great R&D department, rip off and duplicate. Blue Cross Blue Shield has funded something in Railroad Park called, we call it Move More, Live Better. I think that's kind of close to what you call it. But we started it in one of our parks, and it was kind of fun because you get like a Tai Chi instructor to just stay out there Tuesday, 6 o'clock, and for 1 hour you do a free lesson. And the first couple of weeks that you're out there, people kind of treat you like you're a Pentecostal and you're going to take up a collection pretty soon. They'll run from you if you go up to tell them that it's free, come on in. But after a while, we've got Tai Chi, Zumba, Piloxing, I've never heard of that, kickboxing, CrossFit, and we're hoping that the park and recs, we're trying to get the park and recs in the outlying areas to pick that up and take it over. All right, one thing I'm real fond of is I like to paddle. I'm an outdoorsy person for that. And we petitioned the Alabama Scenic River Trails Organization. Fred Couch and his people came down, and we were hoping to get one blueway, one waterway on their state list. And they liked 4 of them. So we now have 4 scenic byways, and it's kind of like that sidewalk thing. You know, it's like, I didn't want to go down to the creek, but now that you tell me it's a blueway, let's see what it's about. We've inventoried the parks, the trails, public open space. We've got, for any of you that are road bikers, don't get run over in Jefferson County. Come to Walker County. We have got Strava heat maps for some of the best rides, anywhere from 20 to a century ride. And other than the dogs, you're not going to get run over. When you're looking at blueways, you might think, well, that's really rural. But I did have the pleasure of working in Jefferson County for a number of years, and you got that on Village Creek, Valley Creek, 5 Mile Creek, Cobble River. You know, take advantage of your blueways, get people out. I'm supposed to be clicking these slides. Because of the interest at the county lake, one of the things we were able to do, and this may not seem like much as far as a Health Action Partnership, we got the parking lot paved. And when you think about it, you know, that sounds kind of dull. But when you look back and you think we've got the Department of Conservation that played along, we've got the County Commission that played along, we've got the city that played along, we've got outside funders that have contributed money to it because they didn't want to give to a parking lot, but they wanted to give money to that thing, our little version of Oak Mountain State Park. We've gotten other funds. I won't even go into that. Next steps, I'm supposed to be done. We got a lot to do. We're looking at, thanks with Carl and Gus, we're looking at the options that we might have in school-based health care. We've got a great critical care hospital that kind of anchors our community, but we also have the luxury of having a very aggressive FQHC that in the last year went from 1 site to 3 sites. One of those sites is in a community with 300 people. And if you don't think they're not appreciative of the fact they have health care, and now I've got a mechanism to go back in and start talking about food nutrition, you'd be surprised. The thing that I really love about this one is that one of their sites is co-located with Northwest Alabama Mental Health. And for the first time, there's almost going to be a little ebb and flow, and they might even be able to share EMRs, and they might even be able to help each other out. So we're excited about that one. Faith-based health promotion, access to recreational spaces, and something that we don't have that should be so easy is after-school programming and summer feeding. But those are the things that we'll be looking at in 16, 17, and 18, and I thank you for your attention.
Sounds like Walker County is definitely going to move out of 67. So congratulations on all that great work. So we're going to spend a few minutes just sort of reflecting back on the day. Does this work now?
No.
The reason I'm wanting it is so that you can talk into it.
Button on the top, hold it down.
Button on the top?
Yeah, that's when it push it down. Okay, so.
Okay, great. Is it on? Oh, yeah. Wow. Amazing. So first of all, we're just going to take about 15 minutes. A lot of you might have been impacted somehow by today, or you might have comments that you want to share with others, or those of us that have been up front speaking, things that we need to hear, your thoughts. So I'd like to start out by just asking about these presentations you just heard from Health Action Partnership, Jefferson County and Walker County. Anybody have any comments on what you've heard?
Good afternoon. I first want to applaud everyone who contributed in some way to today's event. This has been a really wonderful opportunity, so thank you all for this. All of the speakers, our headliner, and then our other headliners, you all were amazing as well. I'm really interested in understanding what are the plans for ensuring that this information doesn't stay here in the room or stay on the health department's website or on any of our individual organizations' websites, because often when I'm in my particular community and at our neighborhood association meetings and at other meetings, so often individuals aren't aware of the wonderful work that's going on within our local communities. And so I was wondering if there is any effort to ensure that there is this opportunity for people to really go to a centralized location and really understand what individuals are doing in terms of healthy food access or the built environment work or access to mental health care, so that they know what our community has prioritized, but then also to understand how they can connect. And so often I think people don't know where they fit into this larger movement that's going on within the county, but there is a lot of synergy and people want to embrace what's going on and get connected.
Okay, thanks. That's a great question and a great challenge. Would anybody in the room care to respond to that?
I think
Okay,
you know, it's, to me, and that's a great question, because I always wonder the same thing. You know, we come and we talk, But then I think our main speaker today, that it really rests on all of our shoulders to be the message carriers. Because there's no one vehicle that I don't think any group or organization can use to reach the community and the core of the community the way that each one of us, reaching one, can do it with the different messages that we give.
I actually think that some of the work that the priority groups are doing inherently has embedded in it a certain amount of connection to the community. And some of that has yet to be developed. But I think for the leadership team, I think that's a question we ought to put on our agenda to make sure we're being more deliberate about that. Because, I mean, we have a website, you know, we have a lot of high-level stuff that all the people in this room know about, but the people that live in the neighborhoods, they don't even know we exist in a lot of cases. So that is a big challenge. And I think we need to keep that before us. I think the health equity piece of this, the fact that we're emphasizing that, and that's really sort of our number one priority, will help, that lens will help make sure we're continuing to do that. Monica?
I was just going to add to that. I mean, definitely part of what the Advancing Health Equity Priority Group is going to do is we go systematically to each of the priority groups and try to figure out, you know, how to assist with their work that's going to be implicated in or helping out in health equity, is to follow those guiding principles. So remember, one of those principles is to make sure that individuals that you are looking to work with or to intervene on are part of that conversation. So part of implementing that principle within our priority groups is to make sure that we figure out how to get that message out in the most appropriate vehicles. And then also one of the principles is about making sure the message is appropriate. So I think the idea behind what we're planning to do, and as each of the priority groups works a little bit more, it will happen that way. But I think overall, the leadership, we've gone back and forth about this conversation of, you know, what is the Health Action Partnership? So as it's created, it is a collaborative effort of organizations rather than individuals. And so somehow finding a way to bridge that is part of the leadership's challenge, and I agree we should think more about that. But historically, this collaborative has been about organization.
Other comments? Edwina, and then over here, okay.
Thank you. Today I heard a lot about health equity, and mainly it's been about African Americans and white people, and I've only heard Latinos mentioned one time, and that was when they were a yellow dot on one of the graphs. And there are a substantial number of Latinos in this community. I would like to see increased access for them included in action steps. I also think that a huge problem in this whole nation, but also in this community, is the way Muslims are being treated right now. And I think that needs to be in our consciousness, and we need to make whatever efforts we can to get equity for those folks. Thank you.
Thank you. I'm getting my exercise steps in today. It's good. Bettina.
This isn't my comment, but Edwina, the Hispanics were mentioned several times throughout the what used to be the Place Matters presentation and the keynote speaker's presentation. But perhaps we need to mention it more. So my comment is that the first time I came to the Health Action Partnership meeting, there were only a handful of people of color, and 3 of them worked for the health department. And so I want to say that just looking around the room, I appreciate the improvements that have been made. And those of you who are new have no idea about this comment, but I've been very critical of the processes. So I just want to say something complimentary. And the inclusion of health equity as a major topic. And so I just want you to know my appreciation, say it publicly to you.
Thank you, official critic. We appreciate you very much. Anybody else?
Mark. Okay. Oh, yes. I want to particularly respond a little bit to the comment around the discussions around other populations other than blacks and whites, particularly in the data. So one of the key issues, and I can probably put the health officer on the spot as well as some other people in the room, is that we are quite challenged by population level data on those individuals. And so that makes it very difficult to measure. So while we do know Jefferson County has a growing population, Latino population, the fact is that that data is so limited relative to other populations, so that when we have the numbers crunched and we are looking at rates per 1,000 or 100,000, when you don't have a substantial number of population, it's really difficult. And when you put those numbers there, they're not really comparable when you go across. So when, one of the slides that I had mentioned the infant mortality rate. So, fortunately, Richard Sinsky was able and thoughtful enough to go find and sort of accumulate some data together over a span of time, about 10 years, to kind of approximate what that is. But that's some of the key challenges. The same area, as I think I mentioned when I was talking, is in the area of disabilities. We do not systematically capture that information, and that's very important. So one of the things the Health Action Partnership has done is saying, with a lot of coaching from RWJ and other folks, we have to be able to measure this to know when we have actually made a difference. And so we need to think more creatively about how we capture that information. What can we use so that we can measure our success?
Thank you. Was there somebody over here?
I was going to echo her.
Okay. Yeah, it is a big challenge. I think I had mentioned that all payers claims database earlier. I think that type of thing where we can get policy change that allows us to get just more data, then that can help. Also, lack of data should not be an excuse for us not being intentional in our outreach. So just want to say that too. Yep.
Thanks, Nick Sims with United Way Central Alabama. So I just have a question, kind of thinking forward about the partnership and the health equity work. We talked about community engagement, with sincere depth in the work and having citizen involvement being meaningful. And I think that's really key. And also I think it's just key as we're looking at these metrics, thinking about also being responsive to emergent community needs. So thinking about the increase in minimum wage and what that can mean for health equity, what that can mean for a community. Thinking about City of Fairfield and what they're going through right now with the layoffs, at the U.S. Steel plant, and also with the loss of the Walmart, what that means for their revenue. I think those are just important things to keep in mind for the partnership of, we've got to stay on task on these things and be focused, but how do we also be responsive to emerging community needs? So I just throw that out there for further consideration for continued dialogue.
Hi, I'm Erica Burrows-Girardi. I am the community coach that has been referenced a couple of times. I work with County Health Rankings and Roadmaps, which is a Robert Wood Johnson Foundation program. We're based in the University of Wisconsin Population Health Institute, but we have community coaches throughout the country. And I happen to live in Florida. But anyway, I just couldn't sit and be quiet anymore. This has been so wonderful. And I actually I'm here to do a site visit with a few selected members from the Health Action Partnership that serve on a team that I coach. And I was planning to come to do a workshop with them about how to have these difficult conversations that Siobhan was talking about this morning. And they invited me to come to the summit, which is, can you coordinate that workshop around the time of the summit? Because we really want you to see what's happening here in Birmingham. And I want to thank them because this has just been awesome. And I'm so excited. And I really had not thought about what you all are dealing with the racial healing that needs to go on in Alabama until I heard it from Siobhan. But I will tell you that when I was a community coach that was selected to work with Jefferson County, you know, there were people that own organizations like, ooh, you know, that's Birmingham. You know, and you know, when I told my family, I'm going to Birmingham to a summit. That's Birmingham, you know. And I thought about what she was saying about this ghost that you guys are fighting with as you are trying to do this very, very difficult work. I want to commend you for moving forward with all of that oppression and heaviness on you. That's hard. So I appreciate the opportunity to be here. A couple of other things I just want to throw out in the mix. You were mentioning about living wage. Guys, you know, you guys are doing some great work with trails and parks, and you get it. You realize that access is one of the ways to get people out there and get them active. But if you don't make a livable wage, and you have to work 2, maybe sometimes 3 jobs just to feed your family, when do you have time to go be active? Do you even feel like being active? I work with this group in Polk County, Texas, which is not too far from Houston. And one of the people on my team said, well, we have all of these trails where people are walking, they just don't want to do it. They just, I just don't know what it is. I'm throwing up my hands. We've done all this. What is it? And I said, well, what is your main industry in Polk County? Logging? Logging. I said, well, what are the hours they're working? Well, that plant, they have to work 12-hour shifts. I said, if you did logging for 12 hours, would you feel like going out to a walking trail after that? No. I said, that's right. We have to think about these things. And so I really, really commend you. I also commend you for knowing that policy is the way to get things done. It takes a while to get policy passed, but boy, is it effective when it does. You just think about those seatbelt laws and how many lives have been saved because we now wear seatbelts. Because I was born in a time when we didn't wear seatbelts. We bounced around in the back of my dad's Impala. But now people wear seatbelts and lots of lives have been saved. So thank you, Katie, for letting me be a part of this. And you guys keep up the great work.
We have about 5 more minutes. Anybody else? I think you're working on evaluations. We have armed guards at the door that won't let you out until you've completed those. This is Alabama, so the guards aren't armed.
So are the test takers.
What's that?
So are the evaluation takers.
Oh, yeah, and the evaluation takers. Okay. Anybody else? Comments on the day in general? Yes, sir.
Thank you. I'll see if I can say this quickly. I've been in Birmingham for 15 years now, and very happily so. And Siobhan was a great speaker and brought up wonderful, great points, but I think she didn't know the area and commended the folks here for all the working together that's going on. As someone who lived in the north and now lives here, you got a lot to be proud of, so I want to make sure that that was said.
Anybody else? Anybody hiding behind one of these pillars? Okay, great. Drew, you want to wrap it up for us?
I will. Yeah, I see. Thank you for coming out and spending the day with us. I think it's meaningful. Thank you for the work all of you are doing towards health in our communities. This is a summit, but we're kind of preaching to the choir because we're all involved. We're all committed to this work. So thank you for being part of it. I get to wrap it up. Just a couple of things. One, I get to stand up, and Dr. Wilson and others get to stand up and be the talking people, but there are folks that work really hard to put these kinds of summits on. I'd like to thank those folks personally, and some of them are still here in the room. There's Katie Peters, Ryan Parker's back there, Gus, And all the folks that worked really hard behind the scenes to put this on, thank you for your work. Also, just a quick announcement, keep an eye out. The Health Equity Group is working on a intensive training around health equity. And if your work group, priority group team is interested, that will be available. So just keep an eye out. They'll be pushing out through the Health Action Network information about that training. Keep an eye out for it. I encourage you to sign up for it when it comes out. And then finally, please be sure to complete the evaluation form and turn it in on your way out the door. Drive safely going home. Thank you very much. Have a great day.